Hi, I'm Brian Birch, physical therapist. This is personal trainer Andrew Lopez, and we're on staff at Birch Physical Therapy. We get a lot of running injuries in the clinic, most of which are associated with the knee. We believe that a lot of knee injuries, especially with running, are related to hip weakness. So what I wanted to do is quickly go over several exercises we think are key for the hip musculature and preventing those aggravating knee injuries associated with running. The first one is a simple clamshell. Andrew's got a band around his knee. He's going to do a clamshell exercise by externally rotating and abducting the hip. Go ahead, Andrew. Good. Just like that. And that's working our hip abductors, specifically the glute medius. And then from there, he can go in an advanced exercise where he's going to do a plank with the clamshell exercise. Go ahead. Maintains a good core, nice straight, doing his hip exercise right there. Perfect. And now we're going to drop down. We're going to work our hip internal rotators. Andrew's got a 2-pound weight on his ankle, and he's going to do a real simple kick to the ceiling, just like that. There's not a lot of motion in the hip there. Good. Perfect. And we can do several sets of reps of 12 to 15. So we're going to move on to our next exercise. This is a single leg squat, or some people call it Bulgarian squat. It's great for working the glutes, but it's also good for balance and core and help train the runner to keep that knee and foot and hips centered and in line. So I'm going to let Andrew go ahead and get into the position. Perfect. And the key here is to keep that alignment from the hip. He should be able to look down his knee and right through his toe. What we don't want to see is that knee drifting in like this angle right here, an increased Q angle, puts a lot of torque on the knee. You see it a lot in runners, especially our female runners. So this is a great exercise for both genders, but I really recommend this for our female athletes. So Andrew's going to go ahead and do a squat. He can start with no weight in his hands. See how he's keeping his knee behind the foot? Go ahead. His knee not passing the plane of the foot. He's also keeping his knee nicely centered over the center of the foot also. Good core motion, good activation of the glutes. Excellent. What we wouldn't want to see is this knee going into a valgus position or him leaning forward and giving way at his trunk. So do that incorrectly for me. You'll see this a lot. So we want to go back to our correct position. Perfect. Just like that. Great. Next exercise. Okay. Exercise we're going to do is a simple squat, an air squat. We're not going to use any weight, although you can incorporate weight into this exercise. We've placed a band around Andrew's knees, and that's going to help work the hip abductors at the same time he's working his glutes and his quads and also his hamstrings. So let's go ahead. He's going to do the same thing. He's going to keep his knee aligned over his toes and keep the knees from going inward. So let's go ahead and do a nice correct one for me. Perfect. Good. Good. And you can also watch depth depending if you have any knee pain. You may have to modify it a little bit. On his next one, he won't go as deep. There you go. But typically, we like you going down to about 60 to 80 degrees like that. Back straight, utilize the core. He's going to turn sideways and do the same exercise. And watch how he doesn't let his knee go in front of him. Perfect. That knee's not going in front of the toes. Okay? He's staying. Go ahead and go one more for me. Perfect. Let's face the camera again and do one incorrectly. Now, see how he's letting the knees cave in? He's not controlling with his hips, and his knees are too far forward. So it's something really to look at. All right, the next exercise is going to be some hip stretching exercises. Andrew's going to go over that. 3 real nice exercises for hip flexibility.
The next exercise we're going to work is the what I call the hip matrix. Okay, it's a great exercise to open up the hip, stretching multiple angles of the hip, really getting you ready for pretty much any lower body exercise you're going to be doing. So first position, I like to use a pad to cushion for my knee, especially if you have sensitivity around the knee. It's good to put some kind of cushion. You're going to start with one knee down on the mat, okay, one knee up in front. Important to line up the joints, okay? You always want to make sure knees are in line with the hip and ankle, okay, both top and bottom. First thing I always do to get started, give your butt a little squeeze, your abs a little squeeze, okay? From there, we're going to push those hips slightly forward. We're going to reach the hands upward towards the ceiling. Okay, we don't want to lean forward. That's going to eliminate the stretch in the hip. We want to stay upright, stay engaged in the core. Okay, that would be angle 1. Angle 2 is out at a 45. Same principle. Okay, abs tight, buns tight, forward, reaching up overhead. Okay, angle 3 is open up to a full 90 if tolerable. Okay, careful on this one. Same principles, abs tight, buns tight. We're going to reach direction of the knee. Okay, with this one, we're just going to reach out in front without the overhead reach on this one. This is going to pull along our hip, our torso into a good deep stretch. All 3 angles on that. That'll be good.
All right, thanks, Andrew. If you have any questions, give us a call at Birch Physical Therapy, 226-9242. We've got a runner's clinic once or twice a month. You can call about information. We can help you with running injuries, put you on an exercise program that's focused on your running, and help you with any problems you may have injury-wise or technique-wise. We're also, we'll be doing video analysis with software. So give us a call if we can help you out. Hope you enjoyed this video. Thanks.